Today, let's talk about the acute treatment of alcohol withdrawal. The universal treatment consists of thiamine, benzodiazepines, folic acid, and magnesium. Because people who abuse alcohol tend to have a deficiency of thiamine, folic acid, and magnesium. So we need to check for these levels and also check for signs of liver failure, as chronic alcohol use can lead to liver cirrhosis. To replenish, we need to give folic acid 1 mg by oral per day, magnesium 400 mg twice or 3 times per day. For benzodiazepines, we usually use diazepam or lorazepam. Diazepam, also called Valium, is longer acting, and lorazepam is shorter acting. 1 mg of lorazepam is equivalent to 5 mg of diazepam. There are 3 methods for alcohol withdrawal treatment. There's the front-loading method, which means giving lots of meds at the beginning. There's the fixed dose method, which is giving a fixed dose at a fixed time. There's a symptom-triggered method, which means medication is given as triggered by the patient's symptoms. For the front-loading method, we can give diazepam 20 mg by oral every 1 to 2 hours as needed, until SIVA score is less than 10, and reassess the SIVA score 1 to 2 hours after the last dose. The treatment is completed when SIVA score is less than 8 on 2 different measurements 1 to 2 hours apart. For people with a history of withdrawal seizures, we would give diazepam 20 mg every 1 hour for a minimum of 3 doses, regardless of subsequent SIVA scores. This method is ideal for patients in the ER, but it does not prevent seizures in patients taking large doses of benzodiazepine in addition to alcohol. Diazepam has a long half-life, so it's long-acting. It can cause prolonged and excessive sedation, so diazepam is contraindicated in the elderly, debilitated patients, liver failure, and individuals with respiratory distress. In these cases, lorazepam, which is shorter acting and not metabolized in the liver, can substitute diazepam. The dose we use is lorazepam by oral, sublingual, or intramuscular 1 to 4 mg every 1 to 2 hours. But lorazepam cannot be front-loading and need to be continuously given over the course of several days. Whether we give benzo IV or by oral is based on the patient's state and symptoms. Some examples of how we can give lorazepam, or also called Ativan, is 2 mg IV push in the beginning, then 1 to 2 mg every 4 hours as needed afterwards. Or we can do 2 mg every 1 hour, then 2 mg every 2 to 3 hours afterwards. Or even a continuous IV drip for 1 mg per hour. If the patient has seizures or delirium tremens, we will give IV diazepam. Note that the seizures, which are generalized tonic-clonics, typically resolve spontaneously. Uncomplicated alcohol withdrawal seizures typically do not require long-term anti-epileptics. For the fixed dose method, a sample detox schedule can be on the first day, diazepam 10 mg 4 times per day, and then on the second day, diazepam 5 mg every 6 hours or 4 times per day. And on the third day, diazepam 5 mg 3 times per day. On the fourth day, diazepam 5 mg twice per day. And on the fifth day, only diazepam 5 mg once per day, and then stop.